Everyone comes in telling a therapist the same thing. I just want to be happy. Let's figure out the science of your happiness. And the way you do this is that
I'm Dr. Kristen Holmes. Dr. Judith Joseph has dedicated her career to helping people overcome high-functioning depression.
So many people were reporting feeling as if something wasn't right, but instead of slowing down, they were overworking.
When we look at their physiology, these folks are burned out.
People with high-functioning depression feel as if no one can do it but them. Really? Is that true? Challenge that control. There's a biopsychosocial model, genetic makeup, your past trauma, things in the environment. And some people, to prevent high-functioning depression, we're going to need to focus more on people feel if they are perceived as anything but strong, that something's wrong with them. You being strong all the time, this was a trauma response.
How do you actually get someone to let go?
I taught them how to use this tool at their desk called the 5-4-3-2-1 method. 5 things that you can see, 4 things that you feel, 3 things that you...
It is such an amazing technique that people can deploy. There are so many distractions in our modern lives that are holding us back from reaching our full potential. If you're here, I guess you're feeling ready to change that and explore what truly matters in your life. We're bringing you thought-provoking conversations and topics every week that will help you focus and unlock your performance and become your best self. Make sure you don't miss out. Please subscribe and don't miss the opportunity we have together to reflect, grow, and create the life that you aspire to. Dr. Joseph, you spend your days working with individuals who are struggling. What has that taught you about joy?
You know, I think what's interesting about working with children, adolescents, adults, and people in their elder years is that everyone comes in with literally telling a therapist the same thing. I just want to be happy.
Yeah.
But the interesting thing is that as a psychiatrist, a therapist, and a researcher, there's this huge disconnect between the science world and the real world.
Mm-hmm.
We are in the business of eradicating depression. We're in the business of eradicating sadness, anxiety, disease, illness, conditions. But our patients are in the business of seeking joy.
Mm-hmm.
And that disconnect is where I think a lot of people end up feeling empty. They feel lost, defeated because they feel as if they've tried and they're just not getting what they want.
Yeah.
And I think that my work tries to bridge that gap so that there is no disconnect between the science and happiness. And that's why I call it the science of your happiness.
Yeah, I love that.
Because we all have our own idea of what happiness is. But if we're looking at that person has happiness, that person has happiness, I want to get that, we end up feeling unsatisfied.
Yeah. Is there a difference between joy and happiness?
Joy is
from
interesting.
a scientific perspective?
Yeah,
have we been able to disentangle the two?
That is a really great question. And in science, we add everything up in points. My sister is an engineer. She's a math whiz in the family. She always says, I love math because math doesn't lie.
Yeah.
And I just thought that was brilliant, so I'm going to steal it from her. But the numbers don't lie.
Yeah.
In science, we add up points of joy, and that's how we come up with the equation for happiness. But in real life, we don't think that way. We go in terms of like our emotions and our feelings and, what happens in the moment. We're not thinking about points. So with my clients, my patients, sometimes I'll sit with them and I'll show them, these were the points that you reported during the last visit, and these are the points now. And that really helps them. It really validates what they're feeling because with mental health, a lot of times it can feel kind of loosey-goosey. Like it's different, compared to cardiology where you can like get a, blood work and you're like, this is your cholesterol and these are these cardiac markers. Whereas with mental health, a lot of times people feel as if, well, how do I really know?
Yeah, it's hard to quantify.
Totally hard to quantify, hard to see. And I call it, and then like a lot of mental health conditions, invisible illnesses because you can't really see it. Yeah. So it's hard to know when you're getting better. And having things in terms of points is really not only validating, but it's helpful to know where you're going. Are you getting more points, less points? Are things staying the same? And I think it's very helpful, not just for me, but for my clients.
Scales.
Yeah.
Where do you sit on the scales?
I know. I know you are too.
I know. So one of my favorite poets is, have you heard of Jane Hirschfield?
No, I haven't.
She's struggled her whole life with depression. So she talks about this interplay between joy and sorrow, and it's very present in all of her work. But she said joy as a form of awareness joy is a conscious engagement.
Mm.
I wonder, given that, joy is kind of what we're all after at the end of the day, right? It's like so foundational to the human condition and we're all kind of seeking it. Where do you begin with kind of building this awareness with the idea that we can develop this conscious awareness? Where do you start?
Well, I'm going to introduce you to something very nuanced.
Okay.
So and challenge people. Rather than saying happy and joy, right? Happier, joyful. And that slight shift is very powerful because if you think of happy, if I tell even a 5-year-old, draw me a picture of what you think being happy is, right? They'll draw a bunch of things. And the same with an adult. Like they'll say, it's that car, it's that partner, it's that job, it's finally getting this and that. But the science shows us that once you get these things, you're not necessarily happy. So rather than looking at it as a static or a stable one thing, think about it as a plethora of sensations, right? And this is where the mind-body really comes into play. One of the suicide researchers and advocates that I respect the most will say, we are thinking about this all wrong. People are searching for things that are actually within their reach, So if you're tired, rest. If you're thirsty, have a sip of water that quenches that thirst. If you're lonely, reach out and connect to someone. These are all of the sensations where most of us are born with that we can utilize and pull on when we want to feel happy, right? Yeah. So rather than happy, it's happier. Try to get all these little points in a day. Yeah. And that is really the marker of happiness. That's why I developed this type of framework because we all have
HALTS. That's part of it.
HALTS has been around for a while, and that was really derived from a lot of people who are overcoming addiction, trying to get back to something that made them feel full and fed. Because a lot of people who struggle with substance issues experience something called anhedonia, which is basically a lack of joy, lack of pleasure, right?
Yeah.
And they feel as if they can't get it again. They're like, I know I used to be happy, but I just can't get anywhere. They experience a lot of anhedonia, meh, blah, nothing excites them. So that framework was developed to allow them to pull on sensation so that they reshift, they reframe, and stop thinking about happiness as being one thing and really a plethora of sensations. So it's in line with that, right?
Yeah.
That's basic self-care. And we think that we have to spend all this money. We think we have to do all these things in order to get these points of joy, but it's just not true. Yeah. Yes, having money is helpful.
Yeah.
And it does give you access to things that many people, can't have, but it doesn't solve the issue. And that's why you have people who are billionaires still feeling anhedonia, still feeling a lack of purpose and not feeling full and fed when they have everything within their reach. They just don't know how to properly identify what being happier is, what being joyful is, because they're getting things onto the next, and it's never enough. The greediest person on the planet will still want more. Even if they're at the top, they're going to worry about, well, what if I'm second? What if I fall behind? What if so-and-so gets more? So it's really about getting back to the basics and understanding the science of your happiness.
Yeah. Is it safe to say that kind of joy and happiness is internal? And perhaps do we know what percentage is internal versus external? It sounds like a lot of the external stuff and looking around for evidence and proof of who you are is not the path. But how do we actually access that internal awareness, where we can use that as our guiding kind of compass and force? That just seems so abstract and kind of hard to grasp.
Well, you and I were talking earlier about how there are very few child psychiatrists. Yeah. It's one of the smallest fields in all of medicine. So if you try to find someone to help your child, you have to be on wait lists for months.
Yeah.
So my mission is to democratize mental health. There's a model that medical students learn. Every medical student knows this model. It's called the Biopsychosocial model. It sounds complicated, but imagine 3 bubbles overlapping like a Venn diagram. What you're talking about is, is it nurture versus nature? So every individual has their unique biopsychosocial. And if you think about the biology is your genetic makeup, your past family history, the medications that you take, your chronic medical conditions, the psychological bucket, your past trauma, your resiliency traits or lack of, your attachment style, your own past psychiatric history. The social bucket, that's things in the environment. So that could be your work environment, your relationships, the foods that you eat, if you're exposed to toxins in the environment, your habits. So we all have a unique biopsychosocial. And understanding that is really helpful. So we know these scary stats that 80% of the people that make up autoimmune conditions in terms of statistics, that's women, right? So if someone comes into my office and their bio is, if they have an autoimmune condition and that's the source of their stressor, I'm going to focus on that first. I want to get that under control versus looking at the other buckets. Yes, they're all important, but in some people, we're going to need to focus more on one of those circles more than the other. If someone has a history of trauma and they have PTSD, and they're hypervigilant and they can't sleep and they avoid people, well, maybe I'm going to focus more on the psychological, right? And if someone's in a toxic relationship with someone who is draining their life source, I'm going to focus on that social part because you could eat all the kale, you can take all the medicine you want, but that person's still there, that's the problem. So I encourage my patients to, and we do this together, we draw our own biopsychosocials. And I think, again, it's validation because with psychiatry and mental health, you can't see a lot of things. But when people see, oh, this is my, makeup, these are the factors that impact me, then we can focus on the areas that we can control because you can't change your genetics, but you can control your medical conditions, right? And it allows people to have a clear plan and to understand themselves. That's why I call it the science of your happiness because we all have our own individual needs. So let's try to understand it.
It's a beautiful framework. And I think that really makes, this idea of, seeking happiness and internally, less abstract, and knowing that, okay, it takes this kind of work around the bio, psycho, and social almost before you can even start to tap that in a consistent, real way. I love that.
It's also just validating because people, a lot of times they just feel like they don't understand. They're like, why me? They're looking at a friend and they're like, well, I read the same book and my life didn't change, or I took the same course and the same retreat. Nothing happened. We are from the same town and we just have such different pathways, right? What happened? And when you are able to give people that concrete, and I think it's an act of love, this is you. It's an act of love to yourself. This is me. This is my life. This is what makes me, who I am. And then you can look at that and say, oh, I understand what happened. I understand that when I was 15, this happened. And that's why I didn't end up in the same place that, a person I admire is in, right? It's extremely validating, very powerful. And it's not excusing, but it's explaining. Yeah. And that explanation, those answers, that's powerful for people.
Yeah. That awareness is empowering, and it almost gives people their agency back to a degree. I love that. I really want to dig into high functioning, because I think this is you've just really been, I think, a pioneer. I think it's hard to assign a new name to anything because you probably get a lot of pushback from colleagues and other researchers and scientists. But I think it's very clear that what you're seeing in your patients is something very different than the persistent depressive disorder that, I think is kind of a cousin to high functioning potentially. So maybe we start there. What is the difference between high functioning depression and persistent depressive disorder?
So when you use something like the DSM or models for diagnostic criteria based on the DSM,
like just the DSM acronyms,
the Diagnostic Statistical Manual for Mental Health Conditions. So it's basically the Bible of right? It's basically the Bible of psychiatry, and we use that. I think to basically have a standardized approach to diagnosis and to treatment. And in clinical research, before you enroll a patient into a clinical study, they have to meet inclusion-exclusion criteria. So what we'll do in my lab is we'll open up something like a mini or a SCID. These are like very thick assessments. And we'll go through it and see if someone meets criteria for a condition. So with major depressive disorder and, dysthymic conditions, chronic conditions, there's usually a box at the end that says, is it significantly impacting your life, your functioning? Is it significantly causing distress? If neither of those is checked, you're out the door. So you can have all these symptoms and not have either of those checked. So what do you do then? Because you have these high-powered people who may actually be exceeding in functioning, maybe over-functioning, and they are not reporting distress and they're not reporting a lack of functioning. What you're going to do is you're going to say, I'll see you next year, or come back once you stop functioning. I thought that model was broken. And especially after the pandemic, so many people were reporting feeling as if something wasn't right. They weren't enjoying things. They were feeling meh or blah. They were having anhedonia. But instead of slowing down, they were actually overworking themselves. They were staying busy. And this was a trauma response. This was their way of coping. But these are people that would not get any support if they were to go to a therapist or to go to a doctor's office. In fact, when I started putting out content about high-functioning depression, I would get DMs from people all the time saying, I just went to my doctor and they said, I'm functioning, come back when I'm not functioning.
Yeah.
That doesn't not make any sense. And I talk about high-functioning depression as the depression of our day, not your grandma's depression,
Yeah.
30, 40 years ago, we didn't have things like social media.
Yeah.
We didn't have access to bad news all the time. We weren't inundated with greed from corporations. Maybe there was a handful of billionaires. Now there's like so many,
So the access to social comparison.
I mean, there's the wealth gap is just unprecedented. There's so many different things. There's so much climate problems. This is a world that is very different. Not to mention, there was a massive pandemic. Who knows what that's done to our brains, that level of inflammation, that infection? We don't know. There's no way to know. So the world today and the stressors today are just not the same they were years ago. Why are we waiting for people to stop functioning? That is not why I went to medicine. I went into medicine to improve people's quality of life. So if we're like neglecting the people who are still showing up, who are the rock of the family, who is a single mother who can't slow down, she can't, be in bed depressed. She's got to show up for her kids. The teacher who won't slow down for her for the class, her students need her. The medical doctor who is just running on empty because his patients need him. These are the people we need to support. Not just the people who we view as weak or vulnerable, but the strong ones. They need support too.
It's just, I do a lot of research with frontline healthcare clinicians, and I'm just like, what you describe is, I think this would be so valuable just to put a name to it. No one is intervening with the surgeon who is just, grinding through, the third shift on call for the fourth night in a row. Like, it's just like these folks are incredibly high functioning. But, when we look at their professional fulfillment index, when we look at perceived stress scores, when we look at, all of the diagnostic, when they these folks are burned out. And when we look at their physiology, we did a study with 270 acute care surgeons, and the mean age was 43. Their physiology looked like a 60-year-old, right? So what we're talking about, all of this, kind of high-functioning depression, like manifests in the physiology. The work that you're doing on social media is so important because you're giving a name to this, right? Like you're helping people understand, wow, okay, I'm actually not okay.
Right.
And I need some intervention here. I need to figure out how to reframe. How do we get this word out more broadly? I mean, these conversations obviously are really helpful, but, there's 280 million people who are suffering depression, right? What proportion are kind of in this category of high-functioning depression who aren't getting assistance?
It's hard to tell because I am doing the first of its kind study in high-functioning depression.
We just don't know, right? Yeah.
And, we do need more information. I'm so glad that you brought up surgeons.
Yeah.
Guess which medical subspecialty makes the most medical errors?
Yeah,
surgeons.
Yeah.
The person who has your life literally in their hands makes the most errors.
Yeah.
And in the medical literature that supports healthcare workers, we always frame things in terms of goals because the only way to get people's attention is by having a collective goal. So what they do is they go to hospitals and say, if you want to decrease your liability rates, if you don't want to get sued, and if you want to improve patient care, you got to take care of your surgeons. You have to focus on their mental health. It's not rocket science.
I know.
But the ingrained culture in medicine is such that a doctor cannot even say that they have depression or anxiety without having to report it to a board. They have to write it down. Yeah. Imagine how shaming that is. Yeah. And I don't know, I went to medical school and it's expensive. Yeah. When I left, I had hundreds of thousands of debt. Do you think a doctor wants to risk not being able to work?
I know.
They can't. That's their livelihood. I talk about a trauma. I've had so many cases of doctors and healthcare workers saying someone mentioned that they should slow down and they felt so triggered because they didn't want to not be able to provide for their families. They didn't want to, not be able to pay off their student loan debt. Mm-hmm. So they literally have no choice. They are stuck between a rock and a hard place. Yes. So they have to push through. They are high functioning AF. That's what I call it.
Yeah.
And so, yes, having a name is powerful. There's something called affect labeling. When people understand what they're experiencing, that act of being able to name it decreases their anxiety. Yeah. It decreases their
cortisol
stress.
levels and adrenaline and epinephrine.
Absolutely, because human beings do not like uncertainty. That's why the pandemic affected us all so much, because the uncertainty was just excruciating, We'd rather be just pull the Band-Aid off, right? We just want to know. And so giving it a name has been very powerful. Giving high-functioning depression a name allows people like myself to do research. Yeah. It allows people to feel seen, validated, and then to do something about it.
What are the actual signs of high-functioning depression? And then let's talk about some of the solutions that you found to be really, really helpful.
High-functioning depression is you will have the symptoms of depression. Yeah. So on my website, I have a free survey that people can take. It's different than the one that I use in clinical research, because in clinical research, it's me or my team sitting with the patient, talking to them, going through it. It's a clinician assessment versus a self-report. But the self-report is easier for people to fill out, and it's not part of the clinical study.
Yeah. Do they consent when they enter into
the clinical study? Yes.
With the survey that you're doing?
The survey, we have a full a disclaimer saying this is not medical treatment.
Well, I have a digital lab here at Whoop.
Okay.
We should get you a digital lab. There's a way to do it. We'll run all that through IRB. It's okay. Because we should be using that for research.
Right. Yeah. Well, we do in person, clinician assessments. But there are labs that do purely, and they have informed consent.
Yeah.
Some of our clinical studies have electronic consents as well. But this one, because it's the first of its kind, I wanted to be able to make sure that people understood what they were being asked. We have a full trauma inventory. People will go through it. And it's developed based on the ACEs questionnaire, the Adverse Childhood Event questionnaire, and the modified ACEs out of Philadelphia that looked at more urban traumas and so forth. But I also modified my trauma inventory to include adult traumas. According to the DSM-5, the Bible of Psychiatry version 5, people are not meeting criteria for trauma unless it's a life-threatening or assault or something really violent like war. But then you have people coming into clinical studies for PTSD saying that, they were in a really toxic relationship where the person harassed them and belittled them. We're well, that doesn't count as trauma according to the DSM-5. Or people will say I lost everything in a bad business deal and I couldn't even, feed myself. Sorry, that doesn't count, right? According to the DSM-5, that doesn't count as a trauma to meet criteria for PTSD. But in my modified trauma inventory, I included all these things that are emotional traumas. Being rejected because of your gender identity, being teased because of your race. These are all traumatic experiences. These are painful experiences that significantly shaped how you see yourself in the world and how others view you in the world, how you interact with the world. And so I included all of these because I wanted people to figure out what was the painful experience in your past that shaped you?
Because these are things that hold people back.
Right? They do. Absolutely.
I mean, these are the source of the stuckness,
Absolutely. Even in my PTSD studies where I have to stick to the DSM's criteria for trauma, if someone's crying and they're telling me this, their trauma, I'll be off the record, I believe you. Your trauma is real. I have to do that as a human being.
I feel this is the menopause conversation 20 years ago. People were this isn't real.
Yeah. Oh my goodness. Yeah. People who menstruate are gaslit all of the time. And again, that could be a trauma for you, going to doctors over and over again saying, I'm struggling. This is impacting my body. It's impacting my relationships. And it's like, well, it's all in your head. I mean, imagine being told that and there was something physiologically wrong with you years after the fact. Well, think about that grief, all that time, all that energy wasted. So if someone comes to me with a story like that, I'll say, on the record, I can't count that as trauma, but off the record, I believe you. I see you. And let's get you the support that you need. But in my trauma inventory, I include all of these painful experiences. And when we interview patients, they'll be like, oh my gosh, I didn't realize that was a trauma. I just kind of like brush that off. And what we'll say is, well, did you know that one of the trauma responses is forgetting? Your brain wants to protect you so that you can survive.
It's adaptive, short term.
Yes.
But it's there.
But it comes out. It'll come out in that relationship.
And that's the cost of not dealing with it, right?
That is the cost.
Yeah.
It will weigh on you. Not processing trauma means that your body will take the brunt of it. It means that you may not reach your full potential. You may self-medicate. You may self-soothe with behaviors that are not healthy or adaptive. A lot of us are on our phone. This is the drug of choice these days. We're just, before you know it, an hour has gone by and you're like, what did I do? I sometimes sit, because we have cameras in our lab, because we do have to monitor the drugs and so forth. And sometimes I'll just like watch people in the waiting area and they're just like that.
I know.
And then it's like, we're calling their name and they're like that.
Let me ask you a question about this, because I deal with a lot of people who struggle with sleeping, and some, in my heart, like I just have so much empathy, for people who can't get a restful night's sleep. And, some folks will say, obviously the light at night is really harmful, right? And we know contributes to mental health issues and obviously impairs sleep. And so I kind of always bring up the light at night and people are like, I just feel like the cost of not scrolling is worse than like impairing my sleep, because it's like they're scrolling like reduces anxiety and kind of, is adaptive in that short term, right? So it's like, how do you weigh that, as a psychiatrist, kind of in these moments with patients where, the alcohol might be serving them in some way, the scrolling might be serving them in some way. Like, how do you create that shift with a patient?
I'm glad you brought that up, because I personally believe that in 10, 20 years, there's going to be a whole section of the DSM, the Bible of Psychiatry, specifically for digital conditions. Yeah. And that's why I said that the depression of today is not your grandma's depression, right? Your grandma didn't have a whole new beast. It's a whole new beast. Lucky for us. But we know that the human brain develops pretty much until 25. But that doesn't mean that the brain doesn't change, right? Develop and change, totally different. You get it as a neuroscientist. So imagine the science we knew 50 years ago doesn't apply completely to today, because our brains are changing in ways that we don't know. And some early studies are showing that very small children who are exposed to this digital type of platform, they're not getting their full development.
Digital diet.
It really is unhealthy for them. And even for people, especially who are vulnerable, who have anxiety and depression, being on these screens, not healthy for us. We see it with our teens. We see the rates of depression rising. Yeah. So, how do you break that? Well, what is it serving? And a lot of times I'll have some of my teens come to my office. They're like, Dr. J, just take this from me. Like, can you just put it over there? They know that they need it and they can't be without it. They hate it. Yeah. It's similar to an addiction. People who struggle with substances, they don't, after a while, the pleasure starts to plateau. Right. And it's more about avoiding the pain, right? They start to get high, not to enjoy, but because it's physiologically painful to be without that substance.
And that's the dark side of dopamine, when it's not.
Exactly.
When effort isn't in proportion to the thing that you're doing, like when it's too easy, like that's when it becomes really maladaptive.
Right. And doom scrolling, that's the thing. Yeah. None of us will ever say it's not real. Just because it's not in the Bible of Psychiatry yet doesn't mean it's not real. Yeah. But we all know it's real. Just like imposter syndrome, we know it's real. It's not in any DSM, but and burnout, guess what? Again, 50 years ago, it wasn't in any of the literature. It wasn't in the ICD-11, 10. It was just completely left out, but we knew it was real. So a lot of things that we know, why are we waiting to classify it to address it? Let's prevent it. Let's prevent high-functioning depression. And my clients who doom scroll, right? Again, books say it's not real, but we know it's real.
Yeah.
What they're doing, doom scrolling by definition, it means that you're looking at this negative stuff. So you're trying to kind of undo, like by learning about these negative things, these things that stress you, it's your brain's faulty way of controlling a situation. Well, if I know it, then somehow I can contain it. Wow. Looking at things that are pleasurable late at night, that's not doom scrolling, right? You're probably a bit of FOMO. You don't want to miss out.
Yeah.
Or it's procrastinating, right? Revenge procrastinating. And so again, I try to understand, what is it feeding? What need is that meeting? And let's understand it. Let's look at your biopsychosocial. Where are we missing things? And let's work on, let's say if you're on the device, if you're anxious and it's your way of calming down, well, let's address your anxiety during the day. There's something called worry procrastination that I use based on metacognition, where we pick, a place in the home or the office that you don't frequent, and at the same time every day for 20 minutes, that's where you're going to worry. And the worries will pop up during the day, and write it down, jot it down on your phone or jot it down on a piece of paper and save it for that worry corner. And when you get there, yes, schedule it. It sounds so silly.
Oh, I love that.
But it is based on science. And what the science shows us is that if we can train our brain to worry at a specific time in a specific place, then we realize that when we get to that corner, those worries were like, oh, why was I worried about that? That was silly, right? Those worries actually go down. And B, we train ourselves to stay focused on what we're doing. So I therapize myself all the time.
I do too. I schedule my worry like literally every day. Before I go to bed, I'm like, yeah,
it really works.
It's like probably one of the more adaptive things I've done in the last decade is like scheduling my worry. Yeah. I think Dr. Judd Brewster.
Oh yeah.
I don't know if you know him. Yeah.
Yes.
I think I got it from him. But yeah, it is such an amazing technique that people can deploy.
It is. And pretty much everyone can do it.
Yeah.
What it does, it also allows you to see that you have some agency. You're like, wow, I can contain this, right?
So would you recommend kind of name your worry? So what would be what would be the best protocol for kind of handling some of this anxiety and kind of shifting potentially away from a lot of the kind of scrolling that we're doing before bed? If you're trying to get someone off of that, how do you think about this optimal protocol for scheduling worry?
Well, if you think about your worry as like a beach ball and you're trying to push it down under the water, if we've all been in pools, it just comes right back up. And cognitive behavioral therapy, which is a more traditional behavioral type of therapy, used to focus on, let's try to change the thought. Let's try to contain the thought. But metacognition is like, well, the thought's going to be there, right? So rather than try to control it, let's get used to it being there and keep moving on with our lives.
Yeah.
And there's a analogy that's often used. It's like the train's coming, but you're not going to get on the train. So you're going to acknowledge, the train's going by, but I'm not going to focus on that train.
Right.
And so I think these are really helpful. Another one is the cloud analogy. Like it's the clouds are going by, but you're not engaging with it.
Yeah.
Because it shows people that if I can practice something a little bit every day, then I will eventually have full control, right? Versus let's try to change the issue. Yeah. Let's try to change that thought. Let's challenge that thought, because you're engaging actively with that thought, and that's exhausting. Yeah, totally. Then you can't focus on changing that thought and the task at hand.
Kind of give yourself a permission in that moment to to worry,
to let go, but not.
And
it's like the elephant in the room. Let the elephant hang out in the room. He could be on his laptop. I'm on mine. I
love that. Let's pause for a moment and talk about today's show sponsor, Shopify, and how it can revolutionize your business. If you're running a digital enterprise, having an innovative e-commerce provider is a non-negotiable. You need a partner whose platform is going to elevate your products and make them stand out from the competition. It's why you need to think about Shopify. As your business grows, Shopify grows with you, providing all the basic tools as you're getting started and the added integrations you'll want as your business expands. With Shopify, you have all your sales channels in one place, including selling through social media marketplaces. So if you're looking to elevate your e-commerce offering for your business or a personal project, check out Shopify. Sign up for a £1 per month trial by visiting shopify.co.uk/Kristen. Again, that's shopify.co.uk/Kristen. Let's pause for a moment to talk about my new show sponsor, Whoop. I've been a part of the Whoop team for almost 9 years. This company is so very close to my heart because at a fundamental level, there's nothing I believe in more than helping people take control of the trajectory of their health and performance. And that really is at the very heart of what Whoop aims to do. And for that reason, I am thrilled to announce that Whoop is a sponsor of Science and Soul. If you haven't heard of Whoop, let me explain. Whoop is a physiological monitoring device. It collects heart rate data from the wrist, and it gives you personal insights on how your body is responding and adapting to external stress. And most importantly, coaches you to a better future. If you're interested in learning more, head to join.whoop.com/science to sign up for a 1-month free trial. That's such a beautiful way, because I think most of us are aware of, of CBT and kind of in cognitive behavioral therapy. And do you see kind of a movement away from that a little bit? Like, as
I think it's still very powerful.
Yeah.
CBT has a lot of literature, and it's scalable. You can now teach CBT groups in countries where they don't have running water, right? So it's very scalable. It's well studied. I don't think it works for people who are very, very, very anxious, who tend to ruminate, right?
Yeah.
Because then they're going to ruminate on
Even
fixing
more.
the thought, right?
Totally.
So it's helpful for people who need just like to be able to have direction on how to let go a little bit.
Yeah.
It's harder to teach that.
Yeah.
And so I think these analogies are very powerful. And if you do this worry procrastination a little bit every day and you keep it in the same place, same time, what you're doing is you're conditioning your brain in the way that when you taught your dog, not to pee on the rug.
Yeah.
You took them out at certain times. You took them to their favorite tree. And then whenever they see that tree, they're like, whoa. It's the same for us. We can condition ourselves to worry. So that's why you have to pick a place that you don't frequent a lot, right? You don't want it to be your favorite chair because you're going to hate that chair.
You bring up a really important point. We can condition ourselves, and we can condition ourselves in a way that's adaptive versus maladaptive. Like, what are some things that people do that you come across that are just like, oh man, we need, like, this is a theme for people. Like this is a pattern of thinking. This is are there just some kind of core themes that come up where you're just like, God, if I wish I could just get this out into the world. And so, so people can just move past this like really maladaptive way of thinking.
Well, I mean, it's based on my own personal experiences. I deal with a lot of people with the high functioning research who feel as if no one can do it but them. And it's like, really? Is that true? I know. I used to be that person. I used to be that person. I mean, I'm high functioning AF. I have a lab.
Yeah.
I do content. I see patients in therapy. I have a small child at home. It's like
you went to medical school and business school at the same time. Like,
right. I was an anesthesiologist and then left and did psychiatry. It's like, talk about letting go. This is like the queen of can't let go, right?
Yeah.
So, but I had to teach myself that I had to let go. And like, it was only when I was going through a divorce and I was like, oh my God, like divorce sucks, by the way.
Yeah.
But like, it was like, this is out of my control. And it was like, well, I need to start to let go a bit because I'm trying to control these things and it's out of my control. What's the worst thing that could happen if I didn't finish the study binder before I left the office? Because it wasn't just going to be one study binder. It was going to turn into data query entry or, checking inventory. And before you know it, the day's gone. And it's like, then I get home and I'm guilty because my daughter was waiting for me. And then it's like this never ending cycle of like, I'm going to drive myself crazy. So I started to work with my clients and say, let's challenge things. What's the worst thing that could happen if you left your phone in your jacket when you went to that party and you didn't check it, right? Let's challenge that. And the person will be like, oh, Dr. Jane, respectfully, I'm very important. It's like, I'm sure you are.
Yeah.
But let's try this. How about if you can't do an hour, let's do 15 minutes, right? Because this person was tied to their phone. They did it Initially they're going to do it for 15 minutes, but they ended up leaving it there for 2 hours. Nothing bad happened.
Wow.
This very important person was okay, having a good time.
The world went on.
Yes. Challenge that worry, that control. And it is going to be helpful for everyone around you. As a parent, we're always like, we find ourselves worrying and obsessing about our kids, but let them mess up.
Yeah.
Let go a bit. What you're teaching them is that you believe in them. You're building their sense of self. You're saying to them, you know what? You can figure it out, and I'm going to trust you to do that. And I'm going to be here for you. I'm not going to shame you. And also, I need to take a break too. You need to learn how to do things, right? So I can rest. But when we let go a bit, people around us change. I always say high-functioning depression is contagious because I know when I was going through my high-functioning AF periods, the lab was tense. It was like, we all can't make mistakes. But then when I started to let go, the joy was contagious too. There was more laughter. People were more relaxed. People were like, bringing in like nice things to eat and like taking their time to eat. So in the same way that your behaviors that are negative are contagious, your behaviors that are positive are contagious. So it's not just impacting you, it's impacting the people that you love and value the most.
It's beautiful. So I think one of the things that like is really challenging to disentangle is the relationship between things like control and self-worth, right? Like, and you can kind of feel controlling with whatever. Because I think, for these high functioning, folks who are really high functioning but unhappy, how much of that high functioning persona is attached to their self-worth? And how do you help a person who is getting rewarded every day by everyone because they're achieving this and that? Like, how do you disentangle the self-worth from that?
That self-worth is tied up in this role. They have people with high-functioning depression. They cannot imagine who they are without their roles. And what I tell them is, there's this meme that I put up. I put up, you're not burnt out. You just forgot who you are, right? And people are like, oh my gosh, that's me,
So good.
At somewhere along the line, you just forgot who you were. You forgot what actually made you feel full and fed, feel that there was a sense of purpose and meaning. And you got tied up in the external motivation. There's something called intrinsic and extrinsic motivation in education that we learn when we're trying to teach children how to really enjoy the joy of learning, right?
I know.
To try and find out how to be curious about the education versus working for the grade. But somewhere along the way, we forget to do this when we're high functioning. We're so caught up in how people perceive us that we forget what it really means to feel purposeful, to feel meaningful, to feel full and fed. And so for a lot of my clients, what I'll do is I'll try to trace back in history. I look at the biopsychosocial, right? But I try to find out what was that point in life where you didn't depend on a role to feel fulfilled, to feel full and fed. And they'll say, well, Dr. J, I don't remember, so long ago. Well, let's try and bring ourselves back to that point in time. And what I find is with a lot of my clients, it'll be like right before a parent got a divorce or right before moving away from home. Or, and one of my most memorable cases was a person who was a part of a sports team, and they thought it was the winning. They were like, well, we won this and we were this and we did that. But then when we did the work, we found out that it wasn't the winning. It was the camaraderie. It was the team experience. So that person actually felt the most purposeful when they were part of a team, when they were part of something bigger than themselves. So what we did with them was we started working on how to build teams in their current role because they were working alone. They were entrepreneur, but they ended up working with organizations that had like-minded interests, and they were part of team building that had a goal. And this was like an organization in the community. And they started to feel what really was a value for them. They thought their value was their title. They thought it was their company, the things that they were getting. But what they truly valued, but they forgot about it, was that sense of a team, camaraderie. So, I think, again, the science of your happiness, you want to look at yourself. You want to look at your unique experiences and figure out when was that point in time. Some people really have a hard time with going in the past because of trauma. They really can't uncover it, or they just don't want to, right? So I'll use different exercises that I lay out in my book, High Functioning, that like, okay, let's find someone that you admire. And let's say you're someone who admires, for me, it's my personal is Oprah. I love Oprah. I've been watching Oprah since I was like a little kid. And
it's so pretty damn amazing.
I mean, I mean, I was like 13 watching her TV. Wow.
You know her.
Well, I met her
Which is kind of
once, yes.
amazing, right?
I met Oprah. But yeah, so like, for her, like, it was like my thing was I admire Oprah because she has the ability to talk with people and people feel seen, right? But when I got so busy with my lab and I was like building it up and getting all these research studies, I forgot why I really got into this. It was so people felt seen. That's why I do clinical research. My dad's a pastor. He's very evangelical. For me, research was about making medication and treatments available to millions, not just a few. But I forgot about, I actually do miss connection. So I had to go back to the basics and slow down and start connecting with people again. So
you bring people back to their why.
You bring them back to their why, their sense of purpose.
Yeah. Yeah, it's interesting. I was at Princeton University for like 13 years, and it's funny because you talked about intrinsic versus extrinsic motivation, and I think it's so hard to get into a school like Duke or Columbia or Princeton. Like you have to be really high functioning, right, to even be selected into a university like that. But what happens is, I think it's the prize, right? It's like, okay, I'm taking the SAT and I need to take it again. And all right, I'm going to have a composite, a super score. And, and then, all right, I want to be an athlete too. So I got to check all of those boxes. So you're just like, you're going through this process where you're just checking one box after another, right? And then you finally get to the thing that you wanted. You get to the prize. And that's when, we would have student athletes be like, what am I even doing? All the reasons that they were kind of checking all those boxes, some of them had nothing to do with them, right? It had to do with pleasing a parent or pleasing someone else. So I'd love for you to just unpack that a little bit.
Yes.
How do we help people? I think understanding your motivation, right? And having and connecting to that intrinsic piece is, I think, one of the most important things that we can teach children and we can get adults to return back to.
Right.
What does that process kind of really look like?
So there's this trifecta of high functioning depression. These are the risk factors.
Yeah.
Number one is trauma, unresolved trauma. For me, it was coming to this country, leaving sunny Trinidad. I have nothing against Jersey. I'm a Jersey girl, but like it ain't Trinidad.
Sure. Nope.
And then my parents, which is a very common dynamic in the Caribbean, is that, one parent comes with the kid, the other one stays behind to work, take care of issues. And, it was just a given that, well, this is just how we do it. And that is very painful for a child to be without their parent.
Yeah.
Even if it's not like the parents are broken up, it's a huge adjustment. And so unresolved trauma from that, scarcity trauma, not at times not knowing where food was going to come from, being in a new country, all of these things are unresolved. That's why when I look at immigrant students, I'm like, high functioning. Yeah. Sometimes it's like, wow, how much unprocessed trauma. And you're not allowed to say, oh, like I'm struggling because so-and-so back home doesn't have what you have. And you should be lucky to be where you are, right? It could be way worse. So there's that trauma, but also masochism. Masochism and masochistic personality disorder was taken out of the DSM-4, I believe. It was in the DSM-3, and they took it out of 4, which is the Bible of Psychiatry, because masochism and traits were thought of as being victim blaming. So people who are masochistic will bend over backwards for others, even if it's actually hurting them, or they feel unworthy of joy. And there are a lot of masochistic personalities in medicine. Right? Like, think about it. You're working long hours. You're not eating. Sometimes surgeons won't pee and they'll brag about it. Yeah, I didn't pee for 20 hours. I was like, that's not good for you, Yeah. But it's such a masochistic culture that you put your needs behind to serve others, and it's ingrained and it's accepted. And if you're not a part of it, you're out. It's part
of your identity too.
It is. It's your whole identity.
It's your whole identity, yeah.
And then the third is anhedonia, where you lose touch with what it is to be a human and you're just going through the motions. Things don't please you anymore.
Blah.
Just the blah. You could be eating your favorite food and you're like, oh, did I finish that? I didn't realize it. Whereas if you're not anhedonic, you're like, my favorite food is lasagna. It's like, that cheese is good. Like that meat was yummy, right?
You find joy in like all the little things.
Yes. So that trifecta makes up high functioning depression.
Wow.
So with my clients, I try to tackle at least one of them. Like if it's someone where the anhedonia is really burdensome, then we work on how to bring up the anhedonia and to bring up points of joy. if it's masochism or people-pleasing behaviors, I have a people-pleasing quiz online. I try to address those interpersonal dynamics so that they challenge their sense of self. So they realize they are not their role. Your role is separate. You have a personality. You are a whole human before you even got into that role. So let's try to tease the two apart.
So roles would be like surgeon, mother, sister. That's what you mean by role, right?
Right. Or the rock, if you're the strong one.
Yeah.
Let's challenge that a bit. You're more than that. There are so many parts of you, But I do think people feel as if they are perceived as anything but strong, that something's wrong with them. And I'm like, I hate to break it to you, but in psychiatry circles and therapy circles, when we see people who are like all put together and they're never vulnerable, we're like, oh, that's the one you got to watch out for. Yeah. So inside joke here, but not really funny. Like, you need to let those guards down. Show a little bit of vulnerability, because you being strong all the time, what that message sends to a professional is that you have high defense mechanisms. Something is behind there, and that something is going to hurt you. So let those guardrails down. Show a bit more vulnerability. It doesn't mean you're weak. It actually takes more strength to show that. So we really try to challenge the roles. And then the trauma, we process the trauma, because sometimes the trauma gets people so stuck that we can't even work on the other parts.
Yeah. What are you feel? You said these words a couple times. One in reference to your divorce. Just letting go.
Oh yes.
I think that's the hardest thing for people who are high functioning. How do you actually get someone to let go?
I actually have a whole section in my book dedicated to this and I use myself as an example.
Yeah.
Sometimes I'll ask for my team's help. I'm like, hey, if you guys see me being high functioning AF, you got to tell me. You got to be like, listen, Dr. J, it's not, no. We have to slow down. Things are busy.
You almost need to see this in the people you love and help keep them accountable and not make them feel shamed that they're high functioning AF. But so, yeah.
You got to show them that it's okay for them to slow down. You have to meet their basic needs.
Yeah.
People with high functioning depression, they're not meeting their basic needs. They're not slowing down to eat. So you have to step in and be like, did you eat today? You have to eat. And I like to use
So what are some behaviors? So not eating, like what are
not eating or eating in front of your laptop, and not peeing for the day, not going to the bathroom for the day. I just gave a talk to a room full of like high functioning leaders, like these women who are incredible. And I was like, I'm going to do a survey really quickly. How many of you recently worked straight through and you had to pee and you didn't pee? Everyone raised their hand.
Oh gosh.
So I'm like, you're not getting a medal for that. Go pee. And they were just laughing because it's so true, right?
Yeah.
Take care of your basic needs. Research shows that if you take even 10-minute breaks in between your meetings, so you will be more productive, happier, better health. So with myself and with my clients, we'll go through the Google Calendar, whatever calendar outlook you use, and we're like, we have to schedule in breaks. Literally, we have to visually see these breaks or else they're not going to happen. And that could be hard for people. They're like, well, I'm so busy, I can't. No one is that busy.
Yeah.
Take a 10-minute break,
It just becomes part of your identity.
It does. People brag about it.
So attached to it.
Yeah, they're like, oh, there's no break in between this and that for this person. Well, that's not cool. It's just not.
Yeah.
Stop doing it. So it doesn't have to be really real. And then again, I do it with myself too. If I'm like scheduling myself, my team will say, listen, you have no breaks. That's not okay. Schedule in lunch. So I look at it.
Working through lunch would be another
working through lunch,
sign.
Staying at work too late. There's someone in my office who's designated to turn the lights off at 5. It's like lock up at 5. No one stays past 5. It's a rule. We had to implement it to contain my behaviors.
To keep you in check.
But everyone's happier, right?
What happens with sleep?
Sleep is sacred. I mean, I remember as a medical student, I used to brag about my all-nighters.
Yeah.
Now, you don't mess with my sleep.
Not a girl.
Not with my sleep. Sleep is so important. It literally, in every mental health condition, sleep is an issue.
How does that manifest in high functioning?
In high functioning people, they are not getting enough sleep or they're not getting rest full sleep.
Right.
They
So
don't have consistent,
they're just rubbering at a
fragmented,
higher
no
heart rate.
consistency, no routine. You're supposed to go to bed at the same time and wake up at the same time. That's our bodies literally are we're creatures of nature and habit. And so we need to pay attention to the amount of light that we're getting, making sure that we're waking up, getting light into our eyes so that we set our circadian rhythm, making sure the room is cool and calm, so not working in the room.
Yeah.
People with high functioning are taking their work into the
laptops,
bedroom.
Yeah.
They're looking at emails at night. It's just the worst thing for your sleep.
Yeah.
You can't activate your brain and expose your brain to stress and be like, okay, it's off, it's gone. The unconscious brain is still processing that meeting that's going to take place the next day because it's the last thing the unconscious brain saw.
Right.
So we really want to make sure that people with high functioning are practicing good sleep hygiene, not bringing their work into the bedroom. The bedroom is only for intimacy and sleep and nothing else.
Beautiful.
The other thing high functioning people do is because they don't eat all day, they eat poorly at night.
Yeah.
And so they end up eating heavily, which disrupts your sleep because your body should be digesting food earlier in the day so that, your sleep is a place where you're cleaning out the toxins from your brain.
Yeah,
you're getting rest. Correct.
With digestion during sleep.
Correct.
Yeah.
So these are all habits that harm you. But on the outside, you feel like you're a badass, right?
Yeah.
But no, you're not.
Yeah.
It's not cool. You got to take care of your body.
How do you preserve some of the positive aspects of the high functioning person while kind of bringing some of these boundaries into play? Because as I'm here talking, I'm like, you start feeling bad about yourself, because what I thought was good actually isn't. So how do I reconcile that?
Well, the talents that made you high functioning, you can use those same talents to take care of your body. I tell my daughter every day, how many bodies did God give you? She goes, 1. Since she was like 3. And then what do you have to do with it? Take care of it, mommy. Aww. We get 1 body. Like, you're not going to get a medal because you grind your body down, right? Like, no one's benefiting from that. Right. Maybe the boss is, the man is, but you're not. Take care of your body. If you don't take care of your body, you're not going to be able to do all of the things that you want in life. You're not going to be able to spend the time with the people that you love the most. So we have to reframe it in terms of that, or else people will not slow down. They literally will not slow down. So I have to use visual cues with my patients, especially my neurodivergent patients. So we'll have these practices like what I do with my daughter, and I'll have them look in a mirror every day and lovingly apply the skin block, the sunblock, the cream, and tell them that my body is precious. I am worthy of care. And it sounds so cheesy. But when you apply this to your skin, you're touching yourself lovingly, you're releasing oxytocin, you're releasing that attachment, that bonding chemical. So you're getting that positive reinforcement that taking care of yourself is actually a good thing, that loving yourself is actually important, it's necessary. But if you're not doing that, then you're sending the message to your inner self that you're not worthy of it, that the other things are more important, that meeting is more important than you. Who do you think you are? But no, we have to love ourselves. We have to be tender with ourselves. We have to practice self-compassion, or else our bodies will suffer and we won't be around for the things that we really love the most.
Who does a high-functioning individual attract?
Well, I talked about masochism, right? And so because they have masochistic traits, they tend to attract takers. Human nature is such that if we're given, people will take. It's that easy.
Who's a taker? What do they look like?
So, in my book, I talk about different types of masochism, cultural, relationship, and the workplace one, the corporate one. A taker in the corporate setting is a boss that sees that your whole identity is tied up in your role.
They just work you to the bone.
They will take. And they'll praise you and belittle you. They'll praise you when you serve them and belittle you when you make a mistake because they know that will get to you, that your whole identity is your role. Or it could be your coworker who knows that you're such a control freak that they can slack off a bit. Oh, you could take care of that for me. Like, oh, thanks so much. You've rescued me from this. And then you're like, yeah, I did that. I'm the hero. But no, you're actually on the losing end because people have sometimes unconsciously, but mostly consciously figured out that you're so tied to your role that they can continue to use you.
Do high-functioning people even feel resentment? Like, does that even come into play? Like, because, I feel like someone who recognizes that would be like, get kind of resentful,
They
how does that
do.
manifest?
They do. Some of them are very aware of it, but their role is everything for them.
Yeah.
So they do get
They get
burnt
more,
out. They do get irritable. They get resentful. But again, they're so tied to their role.
Yeah.
They're like, well, I have to do it anyway.
Yeah.
Versus let me just stop and see what happens when I stop. Someone else is going to pick up the slack.
What about relationships?
In relationships, the person, yes, a lot of times masochistic individuals are into saving others. So their identity, their whole role is I'm going to fix this person. I'm going to heal this person. But what I found is that when people who don't want to be healed, when you try to heal them, they will blame you when it doesn't work out, and they won't thank you when they get better. So stop helping people, not in the way of like all people, but stop helping people who don't want to be helped.
Yeah.
You know, focus on yourself. Who's taking care of you? That's why I developed the
What
people
does Mel
pleaser.
say? Let it.
Let them.
Let them.
Let them.
Let them.
Yes, but her second part of let them is let me, right? It's not just
me.
let them, it's
Right.
let me start doing things.
Right.
So with my clients, we start focusing on the person themselves. Like, why are you trying to change them? No matter what you do, they're not changing. Focus on you. That's all you can really control.
Yeah.
Work on yourself. And when you start to build up your self-esteem, build up your confidence, work on yourself, people see it.
Yeah.
They'll
They're
be like,
attracted to that.
Everyone's attracted
Right?
to
You get
that.
the right kind of people
Yes.
attracted to that.
You get the people who are not just there to take. They want to be around greatness. They're like, ooh, wow. And a lot of times when you're giving, the people who you're giving and you're helping, they resent you because they start to feel like, well, you don't think I'm good
They're
enough.
not appreciative.
They're not.
It's a
lose-lose
situation.
Right.
Not speaking from experience or anything.
They don't appreciate it. They blame you.
Yeah.
So then who benefits?
Yes.
No one.
Yeah.
No one benefits.
Yeah.
So, and I do think that many people out of trauma, right, the trifecta, they don't want to work on themselves. They'd rather fix someone else because if they stopped and focused on themselves, they'd have to uncover things that scare them, that they don't want to deal with, right?
So people, in order to kind of get over that hump, you have to sit in a pretty decent level of discomfort.
Mm-hmm.
How does someone get through that, right? Because it's not just like the mental discomfort.
Yes.
It's the physiological discomfort
It
of
is.
actually being in a parasympathetic state.
Yes.
Which, as you know very well, we've got two sides to the autonomic
Right.
nervous system,
Yes.
and the high-functioning individual is sympathetically driven all the time, right? So they are in a state where they've got high cortisol, adrenaline, epinephrine. That's why sleep is disrupted. That's why they're just constantly anxious and moving. And when they get, I see this in some of our surgeon kind of frontline healthcare population, when they're in a parasympathetic state through meditation or breath work, they get really anxious and uncomfortable. Like, how do you reconcile that with patients? Like, how do you teach them to get into that parasympathetic state and actually allow themselves to stay in it?
Yeah, and I mentioned trauma is really prevalent. So I use a lot of the trauma techniques that work with my clients and my patients who have PTSD. I recently gave a talk at the White House and talk about like an intense environment where people love what they do, but it's stressful.
Oh, yeah.
Very
those
stressful,
folks
right?
Yeah.
I taught them how to use this tool at their desk called the 5-4-3-2-1 method, and it's used in grounding with PTSD and trauma. And you essentially pull on 5 things that you can see, 4 things that you feel, 3 things that you hear, 2 things you smell, 1 thing you taste. And it sounds super basic, but it's really bringing you back into your body. Because one of the symptoms of being having a trauma response is feeling detached from your body. So people will be like, I kind of felt like I wasn't even there, or they feel detached from their situation and they just don't feel like grounded. So this is a simple tool to ground yourself, to remind you that you are a human being, to help you stay present. And you can do it at your desk. And I really ask my clients to change their surroundings. So like, make sure you're looking at something good.
5 things you can see. 3 things.
4 things that you can feel. 3 things that you can hear. 2 things that you can smell. And 1 thing you can taste.
Wow.
So in my office, in my therapy office, we actually do this together if the patient comes in. But if they're home on Zoom or whatever platform, then they'll show me around their room.
Yeah.
In my office, I have plants. So I'll ask my clients to focus on one thing in the office, like the plant, and describe it. What do you see is, the petal and the vase, and they really describe it. And then the feel, I keep a lot of plushy things. So they'll describe what they're feeling. The hearing, I'm right above a fire station. So I use a lot of like noise machines in my office. So they'll listen to certain noises from the machine, but people could listen to music if they want. And then the smell, we have a lot of oil diffusers and scents in the office. And then taste, I have peppermints and like some of the candies that they can taste. But what they're doing when they practice 5, 4, 3, 2, 1, if they're really paying attention to the senses, they forget the problem. They forget what was stressing them out because you're staying so engaged in the moment. And you're seeing that you can wall off, whatever is stressing you out. You can wall it off, you can contain it. It teaches you that agency, that ability that you didn't think that you had, that the thing that was bothering you wasn't so big. Yeah. You were able to stay present. So I think that is very helpful. And usually after that exercise, there's more clarity. So if there's something that they were trying to access that they couldn't access, they're able to access it after practicing that for a while. And then you can do this anywhere. If you're in the airports are very triggering environments. Yeah. So sometimes I'll have my clients have a coping clutch, which is a purse or a coping case. And they'll have all of these things that they can put into there that they can stimulate the senses. And so they're in this very stressful environment. They're on the plane waiting to take off, and it's 3 hours have passed, but they have their 5, 4, 3, 2, 1. They can practice that. If they're about to go into a meeting and they're afraid, they can practice that. So it's something anyone can do anyone who can utilize the 5 senses can do.
And we know that when you are not thinking about the future, not thinking at the past, you're indeed in the present, you actually activate the parasympathetic branch of the nervous system. So you're kind of bringing them, this is a beautiful tool. Yeah. I love that.
You have to be creative with different people and meet them where they are. I'm from the Caribbean, and we do a lot of dancing. We whine, we do soca side to side. Nice. And it was only as an adult that I realized, wait a second, that movement side to side, that's our form of bilateral stimulation, right? That we learn at these institutions like Harvard, that like bilaterally stimulating your body.
That's why when you hold a baby, you just,
that's
side the way to soothe them.
Right. Yeah. Because the left and right brain are communicating, and that makes us feel better as a whole. There's more connectivity, there's more movement in the brain. So when we're dancing, the dancing actually feels good. Yeah. It feels really good. And now we know why. So think about your culture, think about things in your past that make you feel good. Because I guarantee you can find the science to back up why it makes you feel good, and you should be doing more of it. And that's why we're all so different. Yeah. For other clients, they'll be like, I don't dance, Dr. J. Like, I'm not doing that. Well, I'm like, well, let's find something else to help you, right? Mm-hmm. Let's figure out what aligns with your beliefs, with who you are, that feels authentic for you. Let's figure out the science of your happiness, right?
Love that. Well, this has been such a joyful conversation.
It was a lot of fun.
It was so much fun. You have so many repetitions with individuals, and have been deep inside the human experience. The good, the bad, the ugly. What does it mean to be human?
For me, being a human is connection. I grew up in a family with 4 kids, and my parents were very active in the community. They still are. Every weekend, we'd go volunteer. And we didn't have much, but my parents were like, we have to give back. We want to be able to help people. It's who we are. So for me, if I'm not connected to humans, and I mentioned this earlier, then that's not being human for me. So if I'm ever in my high functioning AF phase, I have to connect. Mm-hmm. I have to connect to humans, to people that I love.
Yeah. Well, the world is lucky to have you. Thank you for all your good work.
Thank you.
The research that you've done. And it's been a real joy today.
Thank you.
As a scientist, I'm deeply committed to working with companies that rigorously test their products, which is why you're hearing me talk about my new show sponsor, Huel. Their range is formulated by registered nutritionists, third-party tested, and I can assure you, it all tastes really good. I've been so impressed. I recently decided to join their science advisory board. On especially busy days, usually when I'm traveling, it can be super hard to hit my macronutrient targets. Huel truly helps me stay on track. It's packed with 27 vitamins and minerals, and I'm just so grateful to join a brand that is trusted by people like you and backed by scientists like me. If you'd like to try the world's #1 complete nutrition brand, you can find it at GNC stores nationwide or at huel.com/Kristen. That's HUEL.com/Kristen.